topic of today's talk will be the role of uric acid as a potential contributor to cardiovascular disease. It's many years that we know that there is a strong epidemiological association between elevated uric acid concentrations and a number of cardiovascular conditions ranging from hypertension to coronary syndromes to heart failure. And there is clear evidence that the higher the uric acid concentration, the greater the prevalence of this disease and the poorer the long-term outcome. So that is a solid information that has been gathered over many years. But the lingering question that has been around for many years is whether this was just an association between two conditions or maybe elevated uric acid concentration were a consequence of a number of other alterations that also can be encountered in these diseases, or whether there is also a primary causative role in elevated uric acid in determining or at least making those diseases worse. And this has been debated for many years. Now we start having much more solid evidence that in fact it is not just an association, but there is also a causative link, meaning that elevated uric acid do contribute to the disease. How do we know this? We know this from basically two different sets of information. One is a number of very detailed studies that clearly show that elevated uric acid concentration predates the development of many diseases, or at least that could be traced already in advance in those who will eventually go on to develop the disease, like children who will eventually become hypertensive at a later age, or relatives of patients with the disease, or sophisticated genetic association studies that also point to a greater prevalence of certain disease in those subjects who have traits for increased uric acid concentration. On the other hand, we now have drugs that can preferentially block the uric acid formation via the xanthine oxidase reaction. And these drugs have proven not only to inhibit the formation of uric acid, but also to reduce the formation of reactive oxygen species that are chemically associated with the enzymatic production of uric acid. In other words, activation of xanthine oxidases produces uric acid and at the same time simultaneously produces reactive oxygen species which can be toxic. If we inhibit those enzymes with the drugs that are available, like the allopurinol that has been around for many years, and the much more powerful and specific inhibitor febuxostat, we do reduce uric acid concentrations. At the same time, we reduce oxygen radical formation, and evidence is accumulating that this will translate into better clinical outcomes.